Good evening, ladies and gentlemen. This is USMLE videos. Tonight, I want to talk a few minutes about von Willebrand's disease. As usual, I invite you to visit our website at www.usmlevideos.net. That is www.usmlevideos.net, where we post videos every day. And you can browse through hundreds of videos and learn so many important points or refresh what you have already studied in order to score high on your USMLE examination. Tonight I want to talk briefly about von Willebrand's disease. There are a few important things we need to remember. First of all, it is the most common inherited bleeding disorder. This is seen in Caucasians, and it is the most common inherited bleeding disorder. Von Willebrand factor, its main function is whenever there is an injury, there will be that matrix, the subendothelium of the vessels is exposed. So the platelets are formed in order to prevent the bleeding. Von Willebrand factor, it actually aggregates the platelets by binding to the platelet glycoprotein 1b. So by binding to platelet receptor glycoprotein 1b, it aggregates all the platelets and thereby it actually increases the tethering of the platelet plug over the site in order to prevent the bleeding. So whenever there is a deficiency in von Willebrand factor, this aggregation of platelets does not take place. Thereby there will be mucosal bleeding. So there is the most common symptom of this disease is bleeding. There are especially three different types of von Willebrand's disease: type 1, type 2 and type 3. In type 1, this is actually most common type of von Willebrand's disease. 75 to 80% of patients develop type 1. In this, it is a quantitative abnormality of von Willebrand factor. So because it is a quantitative problem, you can actually treat it with an agent that actually increases the release of von Willebrand factor into the blood. That's why we use desmopressin to treat type 1 von Willebrand disease. Type 2 von Willebrand disease, it accounts for like 15 to 20% of patients, and it is characterized by defects in decreased binding of von Willebrand factor to factor 8 or to platelets. So type 2 actually divided into two more types, type 2N and type 2M. Type 2N is decreased binding to factor 8, whereas type 2M is decreased binding to platelets. So there is a type 3 also, that is very rare, and it is characterized by the absence of von Willebrand factor. So basically there are three different types of von Willebrand disease. Type 1 is accounting for almost 80% of cases. Now symptoms and signs. The most basic symptom is bleeding, as I mentioned earlier. It could be into integument or mucosal membranes, but in type 2 and type 3 the bleeding will be severe. Now laboratory findings. Laboratory findings in type 1, von Willebrand factor activity and antigen are mildly depressed. Whereas in type 2A and 2B, there will be decreased ratio of von Willebrand factor. There will be thrombocytopenia, is very common in type 2. Now, the most basic laboratory points you need to remember. In type 1, von Willebrand factor activity is decreased, von Willebrand factor antigen is decreased, REPA, that is ristocetin induced platelet aggregation, it is decreased. In type 2, von Willebrand factor activity is markedly decreased. In type 3, it is almost absent. So those are the main points when it comes to laboratory diagnosis. One more thing is factor 8. You see, factor 8 binds to von Willebrand factor and circulates in the blood. So that's why its half-life prolongs when it binds to von Willebrand factor. But when von Willebrand factor is absent in the blood, the half-life of factor 8 is decreased. Thereby, factor 8 levels are also decreased in von Willebrand factor disease. So those are the most important things we need to remember in laboratory diagnosis. Now finally, a few things about treatment. The most important thing you need to remember is desmopressin. Desmopressin is the agent of choice when you treat type 1 von Willebrand factor disease. When patients become unresponsive to desmopressin, you should think of von Willebrand factor concentrate and factor 8 concentrate. In type 2 and type 3, you should give von Willebrand factor concentrates. So basically, in type 1, it is desmopressin, and in type 1 unresponsive, type 2 and type 3, it is von Willebrand factor concentrate. So those are the most important things you need to remember. If you feel there are something I left out, please feel free to post them on our website at www.usmlevideos.net so others can read them, understand them, master them, and score high. As usual, I invite you to our website at www.usmlevideos.net. Thank you. Have a good night.